Right now, staying home is an act of love for one's family, one's community, and indeed King County. We must take steps to protect the most vulnerable in our community from getting sick and preserve the healthcare system for those who need it most. We're extremely grateful for the support of these faith leaders, and they've provided us guidance as well so that we together can protect our community. We could not do this without them.
We're going out to elders' homes and figuring out, what do they need? Checking in with people. And communication is the biggest key in all of this. And I just pray that each and every one of you are doing that we're taking care of each other through this process, because that's what it takes, is a community of caring for each other.
One of the things that we talked about this morning was about the social distancing and changing that language to physical distancing, because being separated socially from things that are familiar with you and your family and friends can cause you more trouble and actually reduce your immune system. So the language was changed to physical distancing.
Our job as good citizens and as members of a faith community that cares deeply about the value of human life is to do what is being asked of us, which is to reduce physical contact dramatically in order to slow the spread of COVID-19. Doing so will give our doctors, nurses, and hospitals a fighting chance. Without a doubt, doing so will save countless lives. We know that there is no higher value.
I believe that we should have an abundance of caution to engage with one another. And physical distancing, in my opinion, is faithful, compassionate, and doing good church. Doing so is lifting up the least among us and taking life seriously, valuing life above everything else. We can be community while also promoting safety. Science is not the enemy of religion or spirituality. In fact, it makes us smart and faithful.
These are unprecedented times. We've not had a pandemic for over 100 years, and we're all put in situations that cause extreme stress, trauma, and just the lack of feeling like you know what tomorrow will bring. Many institutions are closed, and people are asked to stay home, which is what we need at this time. But with that becomes more isolation and more trauma. Public health knows that connection is one of the foundational elements of health and has been of grave concern to me every day. Social isolation can be such a lead to poor health. That is why in these times, so many of us turn to our faith leaders in our communities as sources of support, encouragement, words that can bring comfort. Faith leaders across King County are providing critical emotional support and finding ways to anchor key critical social services in a very stressful time.